Good morning, all. I just wanted to welcome you to our monthly WEHA Wednesday webinar. I ask that you please keep your microphone on mute as we are presenting. This is being recorded, and I will turn it away to Trista.
Hi, good morning. Today I'm going to be introducing Jordan Murray. She is the Wisconsin Water Resources Science Policy Fellow. She is stationed at the Wisconsin Department of Health Services, where she serves as the Harmful Algal Blooms Program Coordinator, or the HABs program. Her work entails the prevention and control of harmful algal bloom related illnesses. Jordan holds a BA in neuroscience and a master's in public health epidemiology. She was born and raised in Toledo, Ohio, just miles from Lake Erie, which is a water body known for significant HAB issues. In 2014, Toledo suffered a water crisis. There was a major bloom in Lake Erie, and they were advised not to drink or even touch the water coming out of the taps. So no cooking, no bathing, no brushing teeth with the water coming out of the taps. They're all things that we take for granted from our municipal water supply. The HABs program is a public health issue that's very personal to her. And as the program coordinator, she gets to help protect the public from the effects that the harmful algal blooms can have. It's fulfilling to do work around an issue that has so greatly affected her home and community. She's only been living in Wisconsin for about 9 months and is spending the time enjoying all of the great places that Wisconsin has to offer. So it's great to have you here, Jordan, and you can take it away.
Yeah, thank you so much for that introduction. We'll share my screen. All right, so yeah, my presentation today will focus on the health effects associated with exposure to blue-green algae or cyanobacteria and the public health approach to dealing with related illnesses in Wisconsin. So just to give a great overview of kind of my background and history and what I do, and just to kind of reiterate that, I've been helping lead Wisconsin's public health response to freshwater blue-green algae for almost a year now. And in this picture on the right is my wonderful mentor, Amanda Cook, who some of you may know. She was the HABs state lead for about 4 years before I assumed this role. All right, so now let's talk about cyanobacteria, also known as blue-green algae. So cyanobacteria are a type of photosynthetic bacteria. They are one of the first organisms, if not the very first, that figured out how to make oxygen. And because of that, they've played an important role in the creation of Earth's atmosphere and water bodies as we know them today. They can be found in most of these lakes, rivers, and streams. Under certain circumstances, though, cyanobacteria can be a health hazard to humans, animals, and the environment. When environmental conditions are just right, cyanobacteria can grow to form what are known as harmful algal blooms, or HABs. These can affect aquatic life and people who use the water for recreational or occupational purposes. Some species of cyanobacteria can produce toxins that can make people and animals sick if they are exposed. And generally, there are 3 types of cyanotoxins, and we group them based on the effects that they have on human and animal health. So hepatotoxins are liver toxins and include microcystin and cylindrospermopsin. These are the 2 most common cyanotoxins that we hear about and observe in our water bodies. Neurotoxins can have harmful effects on the nervous system, and these include anatoxin A and saxitoxin. And finally, we also see dermatotoxic effects of cyanobacterial cell components, such as lipopolysaccharide endotoxins, which can result in skin irritation or a rash. One important thing I want to point out is that the species of cyanobacteria that do produce toxins don't produce them all of the time. The signs and symptoms that develop from exposure to cyanobacterial toxins depend on things like the route of exposure, which I'll talk about in a minute, the species of cyanobacteria that we're dealing with and what toxins they produce, cyanobacterial cell and toxin concentrations, and existing vulnerabilities. So certain factors like behavior, body size, pre-existing conditions like skin sensitivities, all these things can put a human or animal at an increased risk of becoming exposed and becoming ill after exposure occurs. And people can be exposed to toxins through a few different ways. So ingesting or swallowing water is the most likely exposure route. And swallowing water with toxins in it could lead to gastrointestinal symptoms like cramps, nausea, diarrhea, and vomiting. Ingestion of neurotoxins can cause symptoms like dizziness, numb lips, and tingling fingers and toes. We don't typically see neurotoxic effects in Wisconsin, and when we do, they're typically observed in animals like dogs. Skin contact is another possible exposure route. If a person comes into contact with algal scum or mats, they might develop a rash, hives, or skin blisters. However, toxins, they're not absorbed through the skin and into the body, so they wouldn't cause symptoms beyond skin irritation. And pictured here on the slide is a rash that developed on a foot after exposure to harmful water conditions. And this is actually a very unique and interesting case that our program at DHS investigated. And the last exposure route I want to mention is inhalation, which is the route of exposure when people participate in activities like tubing or water skiing through a bloom. Generally, their mouths are open and it becomes easy for them to breathe in water droplets. And when this happens, we might see something like a cold-like illness develop, like a runny nose or eyes, sore throat, or a cough. And our animals are affected by cyanotoxins too. We've seen adverse health effects and even death in dogs, wildlife, and livestock who are exposed to toxins. Animals are especially susceptible because they aren't as easily deterred from smelly green water as humans are. They also tend to be smaller in size, meaning that it doesn't take much toxin to make them sick. And when we hear about large fish kills or bird die-offs in a water body experiencing a bloom, we can hypothesize that cyanobacteria and cyanotoxins may be playing a role. And in this way, an animal illness during a bloom can kind of serve as a sentinel for human illness. And because animals need a relatively smaller dose to become ill, severe symptoms are more commonly seen in them. So symptoms can include things like respiratory distress and paralysis, as well as seizures, coma, and death. We can also see liver damage and liver failure after ingestion of liver toxins. And because toxins are fast-acting agents, onset of symptoms in animals and humans as well generally occurs within minutes to hours following exposure. All right, so now I'm going to tell you a little bit about the Harmful Algal Blooms program at the Wisconsin Department of Health Services. So our program exists to prevent and manage blue-green algae-related illnesses in Wisconsin. And our ultimate goal is to protect and promote the health of the wonderful people of Wisconsin. Our program started in 2008 because that was the year that the CDC began tracking voluntarily reported cases of HAB-related illnesses. And since then, our staff support has been made possible primarily by CDC fellowships, and the University of Wisconsin Sea Grants and Water Resources Institute. For 14 years, we've worked diligently with state partners to investigate HAB-related illness in Wisconsin. And this core partnership consists of us, the Wisconsin Department of Health Services, the Department of Natural Resources, and the State Laboratory of Hygiene. And it's always great to put faces to names. So here you can see the 3 groups of people who make these partnerships possible. Amanda and I are at the top. On the bottom left is Gina. She's our statewide harmful algal blooms coordinator at the Wisconsin DNR. And Gina is another one of my amazing mentors, and she is actually on this call today. And lastly, on the bottom right is Dawn. She's our state lab microbiologist. And so in a nutshell, our program conducts surveillance of health effects related to HAB exposure. We investigate reports of human and animal illnesses. We coordinate water sampling and analysis. We help local public health issue health advisories and beach closures. And we provide education and outreach to local jurisdictions and the public. So how do these activities fit into a typical illness investigation? So first, we receive an animal or human illness complaint. We most commonly receive complaints through a reporting tool located on our website, but we also receive complaints via phone calls or emails from the complainant or through referrals from the DNR, local health departments, lake associations, the Wisconsin Poison Center, and sometimes clinicians. And here's a screenshot of our DHS blue-green algae website. You can get to it by Googling Wisconsin Department of Health blue-green algae. And you'll see at the bottom of the page, there's a link to report a suspected blue-green algae illness. This method of reporting is very valuable to our program because about 1/3 of our complaints are received through this reporting tool. And in the 14 years of our program, we've received a total of 307 health complaints related to blue-green algae, with an average of about 23 per year. And I do want to point out that the health complaints shown here include illnesses in people and animals. So after our program receives the health complaints, we begin the investigation by interviewing the patient or animal owner. What we want to know by interviewing them is, could the illness in question possibly be due to cyanobacteria? Did the person or animal actually have an exposure to a water body? And if so, did the water conditions suggest a bloom? Are the signs and symptoms, their onset and duration, consistent with what we know about HAB-related illness? So these are some of the questions that we seek to answer by interviewing the complainant. And if the illness sounds like it could potentially be due to cyanobacteria, we usually contact Gina, regional DNR staff, and the local health officer of the jurisdiction where the lake is located in order to brief them on the suspect illness. And so after we assess the information provided during the interview, we will decide if water sampling is necessary. And to do this, we consult with Gina to kind of gauge her thoughts about whether sampling the water is justified or not. We want to know, is the water still representative of conditions at the time of the person's exposure? So what does the water look like now? How many days have passed since the person or animal was exposed? Have significant environmental events caused, or are they suspected to cause changes to the bloom before sampling? So things like time, weather, and the transient nature of blooms can significantly affect concentrations of cyanobacteria and cytotoxins in the water to the point where they may no longer be representative. And if the illness in question does sound like it could potentially be due to cyanobacteria, and if the water conditions are still representative at the time, or of those at the time of exposure, Gina works with regional DNR staff to collect water samples, which, by the way, does instruct field staff to wear rubber gloves during sample collection. So samples are then sent to Dawn at the State Lab of Hygiene, who microscopically identifies and enumerates cyanobacteria in the sample and conducts toxin testing. And after Dawn analyzes the samples, she reports the results back to me and Gina. And finally, we interpret the level of health risk present and take the steps necessary to protect public health. We typically share the water sample results and the health risks with local health officials. Local health can then issue a health advisory, a closing or restricting access to a beach or swim area impacted by a bloom. And generally, the local health department will work with the DHS HAB program on appropriate messaging, especially to the public regarding HAB health risks. And on this slide is an example of a health alert developed by our program on the left and a press release from a local health department on the right. All right, so now we are going to dive into some HAB-related illness case studies. So you can kind of get an idea of the kinds of illness reports we receive every HAB season. And we will get started with a human case study. So in August of 2017, DHS received a report of a suspected blue-green algae exposure from the Wisconsin Poison Center. The report indicated that a 17-year-old male became ill with gastrointestinal illness the day after recreating in a lake for about 30 minutes. When we interviewed the family the following week, and we learned that the boy and his father had visited a county park where they had entered the water to play catch with a football. Their activities included swimming and dunking each other below the surface of the water. And during the interview, we learned that the father was also ill with similar symptoms. Both men experienced headaches within 1 hour of exposure. And the following morning, both developed abdominal cramping and diarrhea that lasted 24 hours. Neither one reported knowing any friends, coworkers, or family who had recently been ill, and neither sought medical care for their symptoms. The reported conditions at the time of the exposure were murky green pea soup water with a rotten egg smell. And the family also observed 3 dead floating carp near where they were recreating. By the time DHS was able to reach the family for an interview, testing of the lake water for algal toxins wasn't warranted because the water would no longer be representative of conditions at the time of the family's exposure. However, the lake water was tested at the deep hole by citizen monitoring on the day of exposure. The Secchi depth at this location was 2.5 feet, which was the shallowest reported depth during the 2017 monitoring period. The clarity of the water was murky and the color green. And so together, these indicators point to a lake that was eutrophic during that time and capable of experiencing a bloom, especially at a shallower shoreline location. And so in reviewing these cases, we had signs and symptoms, including their onsets and durations, which were characteristic of cases of HAB-related gastrointestinal illness. And in addition, both visual observations by the family and environmental data collected by the local citizen monitoring network suggested that a bloom was present during the exposure. Unfortunately, lab-based data on cyanobacteria cell and toxin concentrations were not available because the water could not be tested. But in the end, public health classified them as a probable but not confirmed cases of HAB-related illnesses. So now we'll talk about one of the animal cases that we investigated. So in late July of 2017, DHS was notified by multiple sources about 2 dogs that died within 1 hour of each other on the same day after swimming in the same lake. We learned that the dogs had no connection to each other and were owned by different families. The dogs swam at 2 different beaches, approximately 5 miles apart. And we knew that the lake is well known for bad blooms, but no blooms were visually observed the day that the dogs died. And the owner of one dog actually went to the media to warn the public of blue-green algae, which she believed had killed her dog. So what happened? Well, we learned that at Beach A Cavalier King Charles Spaniel was swimming and playing fetch in the water for approximately 1 hour. The first sign of illness reported by the owner was a loss of balance about 40 minutes into swimming. And during their 10-minute walk home, the dog urinated frequently and had a loose stool. When they arrived home, the dog began salivating and frothing at the mouth. The dog vomited and eventually became unconscious. The owner reported that at the time of the dog's exposure, the water looked brown and murky with no signs of an algal bloom. And around the same time at Beach B, a border terrier was swimming and playing fetch in the water for about 25 minutes. The first sign of illness reported by the owner was staggering and a loss of balance about 20 minutes after returning home. And shortly after, the dog began twisting and turning as if in pain, began convulsing, and eventually became unconscious. The owner reported that the water looked brown and murky at the time of the dog's exposure, with no signs of an algal bloom. And you might remember this slide from earlier. So in addition to our usual partners, this investigation also involved partners with the local health department, veterinarians, and the local lake association. Each group really played an integral role in the investigation process. So DHS interviewed the dog owners and served as the point of contact between investigation partners. The DNR collected and analyzed water samples at both beaches where the dogs were exposed. And the state lab analyzed water samples as well as the dog's stomach contents for cyanobacteria and cyanotoxins. The local health department did their own collection and analysis of water samples. The local lake association shared results from routine monitoring conducted at one of the beaches on the day of the dog's exposures. And the veterinarians received, examined, and attempted to treat the animals during their ER visits. They performed necropsies and additional postmortem testing on both dogs in an effort to search for a cause of death. So what were our findings? Well, water collected at one or both sites the day of and the day after the dog's exposures resulted in low cyanobacterial cell counts with either non-detectable or very low levels of cyanotoxins. Stomach contents from both dogs were collected post-mortem on the day following their deaths and were analyzed at state lab for several cyanobacterial toxins. And in both specimens, not one cyanotoxin was identified. Postmortem analyses and necropsies ruled out cyanotoxin exposure and identified possible other causes of death. One dog exhibited signs of heart defects and a brainstem herniation, and the other had abnormally low levels of cholinesterase, which can be a sign of pesticide exposure. And in the end, these dogs were deemed not to be cases of HAB-related illness. Many of the health complaints that our program receives every year actually turn out to be not related to blue-green algae after all. This particular intensive investigation really kind of highlights the importance of diverse partnerships in investigating suspect cases of HAB-related illness. So this investigation also showed how high awareness of algal blooms in a community often affected by them can result in increased reporting and media attention. So now I kind of want to talk about the bigger picture. So why are HABs an important public health matter, and why should we continue to care about them? So you know that HABs are an emerging public health problem worldwide, with areas all over the globe experiencing problems. And secondly, the warming effects of climate change are projected to increase the severity, magnitude, and distribution of this problem in the future. And lastly, the health impacts from HABs are still pretty poorly understood. Most of what we know about health impacts comes from animal toxicity studies and anecdotal case reports instead of large-scale controlled epidemiologic studies. And therefore, we really rely on people reporting cases to us so we can learn more about the kinds of signs, symptoms, risk factors, and and health outcomes associated with HAB exposure. Having this knowledge will really help us to prevent these illnesses in the future. But in order to learn more about HAB-related illnesses, we do need to hear about them. And unfortunately, illnesses are not always reported to us, and there are a few reasons for this. So not everyone is aware of what HABs are, what they look like, that they can cause illness, and what types of symptoms they can produce. HAB-related illnesses they're very challenging to diagnose. Most symptoms are so vague that they sound like other conditions like swimmer's itch, food poisoning, or allergies. HAB-related illness, they don't have a single signature sign or symptom that kind of clues us in. And in most cases, illness is not severe enough to warrant medical attention. And even in cases severe enough to be seen by a doctor or veterinarian, the level of awareness of HAB-related illness among medical professionals can vary. And therefore, being seen does not guarantee that the practitioner will recognize the illness as HAB-related. There's also no currently commercially available diagnostic tests that the doctor could run, for example, on a blood sample to confirm that your illness was in fact due to HAB exposure. And so together you can kind of begin to understand how all of these factors contribute to a potential underestimation of the number of HAB cases seen across Wisconsin and the country. So there's a few different things we can do to help prevent related illnesses. And for the sake of time, I'll just run through these pretty quickly. So we can do things like become familiar with the signs and symptoms of HAB-related illness. We can educate others about blooms and related illnesses. We can report suspected human and animal illnesses to our local or state public health authorities. We can encourage others to report suspected illnesses, and we can report obvious blooms to our state environmental resources agencies. And there are also a few simple precautions that you can take to protect yourselves, your family, your friends, and your pets from any harmful effects of blue-green algae exposure. So try not to swim or allow your kids or pets to swim where water is discolored or where you see foam, scum, or algal mats. Try not to boat, tube, water ski, jet ski, or wakeboard through algal blooms. Make sure to shower or rinse off with fresh and clean water after swimming in freshwater bodies. And keep your pets out of discolored water or where you see foam, scum, or mats of algae. If your dog does swim in scummy water, try to rinse them off right away and don't let them lick algae off of their fur. And always look out for and respect any posted beach closures and health advisories because they are there for a reason. And if you're ever not sure about what might be in the water, it is always best to err on the side of caution. And our program likes to tell people, when you're in doubt, stay out. So this information, along with other useful information, is included in some of the great resources that our program offers. So we offer fact sheets on how to protect your family and your pets from the harmful effects of blue-green algae. We also offer one with a photo guide of specific bloom conditions to avoid, as well as a guide to help you differentiate between harmful conditions and their non-harmful lookalikes. You can find these fact sheets and more by visiting our website and searching algae. We also have a fact sheet that, similar to the one just mentioned, that is geared toward summer camp directors and staff. This fact sheet, it's not geared toward the public and not available on our website. So if you'd like a link to this one, you can reach out to me using my contact info at the end of the presentation. Our program also offers blue-green algae signage, which is also not available to the public. So if you are interested in obtaining one of our signs, you can contact me directly. So these signs are posted at some of our state's public health beaches and boat launches, but not all locations will have them. So we always tell people to assess the conditions themselves before getting into the water. And we recently created and published our newest sign, which is a sign aimed to inform pet owners to be on the lookout for HABs in the water, as well as provide guidance for best practices to protect people and their pets for HABs. This sign is meant to be posted at designated dog swim areas that are at risk for blooms in your jurisdiction. And so to recap, please report blooms without accompanying illnesses to the DNR. And remember to include descriptions of bloom size, duration, and location with lake, town, county name, as well as any photos taken both close up and farther away. And to report a human or animal illness, please contact the local health department or the Wisconsin Division of Public Health by calling 608-266-1120. And you can also tell citizens who are reporting a bloom to you that there's an online survey for reporting illnesses available on our website. And so that is the end of my presentation. Thank you so much for listening. I'm happy to answer any questions at this time.
Yeah, thank you, Jordan. We do have a few that popped up in chat, but it looks like Gina is on top of it. She is already responding to a bunch of them. So thank you, Gina, for that.
That's awesome.
If anyone is brave enough to come off of mute and ask a question, please feel free to do so at this time.
Oh, looks like Gina just put something in the chat about our HAB program e-newsletter. So really quickly, our program, we offer a newsletter that gets sent out to local jurisdictions and local tribes and other state agencies. This newsletter gets sent out every few months, and it just includes up-to-date information about blue-green algae, what our program has been up to, and we also offer advice and guidance for local jurisdictions on like how to deal with reporting of blooms, and if someone reports an illness to your jurisdiction, you know, how do you go about that? How do you respond to that? Things like that. We recently sent out a newsletter on Monday, actually, which was kind of provided guidance for local jurisdictions with the upcoming blue-green algae season. So guidance about reporting, what kind of messaging to provide for people who report blooms to you, and things like that. So very helpful information. And if you're interested in receiving these oh, Gina just posted a link to the newsletters. But if you're interested in subscribing to these newsletters, you can email me directly and I can put you on the recipient list.
Oh, and Stephanie Sticka has a great question about rec ed camps and the brochure. It says rec ed HAB brochure only has DNR contact. Should it be updated to also include the DHS program?
Yeah, that's a good thought, Stephanie. I didn't realize it only had the DNR contact. So yeah, you're right. It should probably be updated to include the DHS program contact as well. So thank you for pointing that out.
Well, and I know we are a few minutes over, so we'll take any last minute questions. Otherwise, you can reach out to Jordan directly or reach out to the resources that she provided. Also keep in mind that this will be posted on our WEHA YouTube channel, so you can always go back and refer to it, especially if you wanted to look back at those resources again. You can always go that route.
Hi, this is Gina. Just one thing. Amber asked about social media posts. The newsletters do have topical sample social media posts that folks can use. So I'd encourage you to either check out the archived newsletters or contact Jordan to get on the mailing list.
Thank you, Gina.
All right, and with that, we will wrap it up for this month. As always, stay tuned for next month. We will be having Katie Matulis. So please feel free to reach out to us with any topic suggestions. We want to make sure that we are getting you the information that you want to hear. So we don't want to just create webinars to create webinars. So please, if there's a topic that you're interested in, please feel free to reach out to us. Again, thank you, Jordan. We appreciate all of your expertise.
Thank you.